One thing I have learned during the COVID-19 pandemic is information is evolving and guidance has been ever changing. So now I tend to question what I can trust and believe is the best cause of action. Between the CDC and the WHO, government leaders and media outlets covering the virus, there has not been any consistency in delivering clinical information, symptoms, testing, and/or deaths. This is difficult to understand when all of these sources are giving different variations of the up-to-date information surrounding the virus. The problem is too much conflicting information surrounding the media reports on COVID-19. In order to fully understand the scope of the coronavirus, it's necessary to discuss the brief history. Events that quickly evolved this year, according to the website www.who.int, that was founded on July 30th, 2020. On December 31st, 2019, the World Health Organization was formally notified of a cluster of cases of pneumonia in Wuhan City, China. And on January 21st, Chinese scientists confirmed COVID-19 is transmitted by humans. The Trump administration declares a public health emergency due to the COVID-19 outbreak on February 3rd. But the WHO doesn't label this as a pandemic until March 19th. However, President Trump on the official www.whitehouse.gov website on March 13, 2020 announced a proclamation for a national emergency due to the novel coronavirus. Shortly thereafter, the entire nation is required to social distance and quarantine. In March, due to an increase in COVID-19 hospitalizations across the U.S., the state governors take guidance from the Centers of Disease Control, www.cdc.gov/coronavirus. Close down schools, businesses, jobs in order to contain the spread of the virus, to not overwhelm hospitals and slow down the spread of the virus. At this time, there is no treatment approved for people who have COVID-19. However, there are two types of tests available. There are viral tests, which are typically nasal swabs that can determine if the infection is still active. And there's also antibody tests to determine if you may have already previously had the disease. The best way to prevent yourself would be to minimize spread of being exposed. Don't get tested if you are asymptomatic and not sure if you were exposed. Texas was shut down for nearly 3 months during this time. After the national media coverage became overwhelmingly negative, this type of news reported escalated fear for one's safety and fears for the economy. As the end of July, Texas is currently forced with a surge of positive cases and a potential to close down again if action is not taken immediately. For Texas to stay open, everyone must follow the minimum health protocols outlined by the Texas of Human Services. As you can see in the PowerPoint, it shows just a few things that you could do to prevent yourself from getting the disease. For one, you should wear a mask at all times. You as well should wash your hands for at least 20 seconds. And you want to maintain your crowd control and make sure you're not in physical contact with any of the groups. As well, if you're sick, you need to stay home. I have two objections that I'd like to speak upon. Why wear a mask if I didn't wear one at the beginning of the pandemic? Because it could reduce the risk of necessary to reduce community spread. Why not get tested if I'm asymptomatic? Because viral tests will not be dependable whether or not if you had the virus recently or you're contracting it now. This is a serious matter and everyone needs to do their share and make sure that they're doing the 3 W's. Wearing your mask, washing your hands, and making sure that you're social distancing.